You know that cardiology is the medical study of the heart, and that neurology is the medical study of the nerves and the nervous system. Perhaps you even know that nephrology is the medical study of the kidneys. Do you know what oncology studies?
If you go back to the word oncology, onkos is from the ancient Greek of mass or tumor, and the logy part is the science or study of. So it's a science or study of tumors. It didn't exist as a specialty, at least in the United States, up until the late 1960s or the 1970s. And the problem there was that, for the most part, as internists, as physicians who use medications, not surgeons, as internists, we had very little to offer. We had very little treatments, and people weren't really thinking that much about prevention. But something very interesting happened, that some medications were discovered and started to be developed that started to have a major impact in some malignancies.
Oncologists who use medications to treat cancers are referred to as clinical or medical oncologists. There are several other subspecialties. These are often differentiated based on what their primary method of treatment is, such as radiation oncology, surgical oncology, and interventional oncology. Gynecologic oncology and pediatric oncology describe their patients, women with cancers of the reproductive system and children, respectively. If you visit an oncologist, you'll probably notice another ology listed that I didn't mention as a subspecialty. That's because it isn't a subspecialty.
In the United States, I think it's about 90% of oncologists are also hematologists, blood specialists. And, sometimes people will come to my office, and I'm sure this happens to most hematologists, oncologists, with a simple blood disorder, simple anemia that, is probably nothing grave in and of itself. But they see that hematology, oncology, and I must have cancer. It happens in the United States because the first cancers, the first malignancies that were cured with medication, curiously enough, were the hematologic malignancies, the leukemias and the lymphomas. So in the United States, unlike other countries, the hematologist became the de facto oncologist and started to wear two different hats. It doesn't happen in Europe, for instance. You have hematologists and you have oncologists, and they're separate. But just a word of caution for anybody who ever has to deal with someone like myself.
Oncologists will normally be introduced to a patient once a cancer diagnosis has been made. While the oncologist is the expert on cancers and cancer treatment, he won't be the lone physician treating the cancer. Oncologists are team players. They work in a multidisciplinary team alongside a radiologist, a pathologist, a surgeon, and sometimes a plastic surgeon or a specialist for whatever organ may be afflicted, such as a dermatologist for skin cancer. This team will also work with your primary care doctor. With all their knowledge and expertise combined, they will choose a treatment course. There are three primary treatment options: radiation, chemotherapy, and surgery.
Now, fundamentally, the three modalities that we use in approaching different forms of cancer, but depending on the specific one, the importance of each modality will be greater or less. The medical oncologist, he or she will use the chemotherapy, the immunotherapy, and the new targeted therapies, and also hormonal therapy. The surgical oncologist, he or she will wield their scalpel or other new instruments that they may have available to themselves for the treatment of cancer. And the radiation oncologist will utilize different forms of radiation directed to different portions of the body that are afflicted by the ailment to help to eradicate the disease. Now, depending on what the actual type of cancer is, you may use one or combinations of the three. And that's part of our learning curve. What's the best way to treat a cancer? Well, for instance, with esophageal cancer, for years they did studies. Well, some people studied chemotherapy, and some people studied radiation, and some people studied surgery. None of those were great fixes on their own. And then they started with different combinations. Well, in the end, we've learned to use a sequence of the three. And the sequence of the three is dramatically better than any one by themselves or even combinations of two at a time.
Once treatment has started, the oncologist will be home base for the patient. They'll follow up on any treatments and track their effectiveness. They'll provide information on the latest cancer treatments and suggest new methods when appropriate. They will also tirelessly work to ensure that through it all, the patient will be as comfortable as possible while fighting the illness. All in all, you'll be really glad to have an oncologist on your side should you ever need one. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.